Hello everyone, I'm Dr. Mary Muthoni, the CEO and the founder of Marian Natural Remedies. And today I want to talk about FIBLO, a very important medication that has been very helpful to women, especially on their journey with infertility. And we have so many successful stories and successful testimonies of those women that came to Marian having fibroids, others they were having blocked fallopian tubes, others they were having ovarian cysts, endometriosis and adenomyosis, and now they have testimonies. And we believe this is a medication, that should be used by every woman that is going through an infertility journey. If you have never tried FIBLO, please give it a try. To try FIBLO medication. It's a very good medication, and it has come to rescue women. Yes, very many people, they have gone through the journey of infertility, but silently they have suffered without no one who is talking about it. So Marian Natural Remedies, we have come to be the voice of this woman who is suffering from infertility. And I myself, Marian, the CEO of Marian Natural Remedies, I was once a time suffering from infertility due to big fibroids. I suffered infertility due to big fibroids, and when I got help, so as I was saying, I once suffered from infertility due to big fibroids, and when I got help today, I'm a mother of many children. That's what I say. I'm the mother of nations. I'm a mother of nations, and I'm proud of that. Yes. So today I have children, and I'm a proud mother. And it was something inside me that I felt I should help women, those who are suffering infertility, those women who don't know who to share with. Others, they are sharing with their families, and it becomes the topic of their family. Others, they share with their friends. Then the friends see it as as your weak point now that you don't have children. And Marian, we are not judgmental. When you come to us, we walk the journey of infertility with you until we see the success of it. So every woman who is here, the whole world, you are suffering from infertility, don't give up before you try Marian Natural Remedies and before you try FIBLO. Yes, and those women who have tried FIBLO, maybe you tried FIBLO, it was not a success. Don't give up. Make it a try. Try it again until you get successful story of your life. Yes, you have seen many testimonies here. Women who are giving birth every day out of using FIBLO. Even you can become one of those women that will post your testimony having been blessed with children. Yes, so we have this medication that we call FIBLO. It's a medication that we have done research. It's well analyzed scientifically. And we had to do this because most women, those who are going through infertility, they don't use family planning. Remember, they don't use, you are not using family planning. Why should you use family planning and you are trying to conceive? Yes. So these women, we had to research on a medication that will help them. And if they conceive along the way, we had to make sure that this medication will not affect the baby. Remember here, the baby, it's the most important gift that we receive on our hands. Yes, so we had to research on a medication that will help these women. Even if they get pregnant along the way, we make sure that this treatment does not affect the pregnancy. And this treatment is the FIBLO. So this FIBLO is taken alongside 3 other medications. We have FIBLO here. We have Lanuta supplement. These are Lanuta supplement. Remember, you have been taking very many medications. Yes. Every woman who is suffering from infertility, they have a journey. They have stories to tell. I have gone to Kisumu. I heard there is a daktari who is at Nakuru. I went there. There was no help. I was told there is another daktari at Mombasa. I went there. So they have stories of trying to get the medication. So that's why we use this Lanita supplement to detoxify their system, to make sure that all those toxins, the medications that you have been taking, both the alternative medicine and the conventional medicine, at least your body is okay now to receive the FIBLO care for the treatment. That's Lanita supplement. Then we have another medication here. This is called Xanthoplas. Xanthoplas complements FIBLO care. And when we talk of complementing, this is a very strong anti-inflammatory. This one, it's also anti-inflammatory. It complements this. When we are shrinking fibroids and clearing them, when we are blocking tubes, this Xanthoplas is very, very important. Then we have another medication here. This one is called vitamin C. We use vitamin C. We know very well vitamin C. It's very, very crucial when it comes to women fertility. It balances the hormones and it boosts ovulation of a woman. Yes, because our main aim is that this woman finally will receive the good news that she's pregnant. So we have these 4 medications. And these 4 medications, they work hand in hand to treat various gynecological problems. The first one, we have the fibroids. And it treats and clears all types of fibroids. We have 4 types of fibroids. We have the subserosal fibroids. These are the fibroids that are located on the posterior side of the uterine wall, the outer cover, the outer cavity of the uterus. That's where you find the subserosal fibroids. And remember, the subserosal fibroids, they can grow big even up to 15 centimeters. You find a person who is having a fibroid measuring 15 centimeters. Mostly those ones, they are subserosal fibroids. They have a capacity to grow very big in your uterus. Subserosal fibroids. Then we have another fibroid that we call submucosal fibroids. Those ones, they are submerged. They are located in between the anterior wall and the posterior wall of the uterine cavity. That's where you find them. Then we have others that we call intramural fibroids. Those are fibroids that are located at the anterior cavity of the uterus, kule ndani, almost kule ndani kwa uterus. And the intramural fibroids, they cause a lot of symptoms in women. These are the women that you find that they are always bleeding. They bleed so much. They have so many symptoms. They cannot get pregnant. And if they get pregnant, they have the highest risk of miscarriage for their pregnancies. Those are intramural fibroids. Then we have pedunculated fibroids. Those are fibroids that are located, most of the time they have a pendulum, the pedunculated fibroids. They have a pendulum-like structure, ni kama imehang hivi. And most of the time, these are the fibroids that blocks the fallopian tubes. Yes, they open once the fallopian tube inafunga hapo. So you find that these women, they suffer from infertility. And let me tell you, there isn't another big monster than the fibroids. Because in our society, the fibroids, they don't seem like it's a disease, it's something that can disturb you to that extent. But I believe those women who are suffering from fibroids, they have fibroids, they can tell you what they go through. Yes, not mentioning even the fatigue. You feel fatigued, even in the morning when you wake up, you feel fatigued. You don't feel like doing anything. You are always tired. Yes. Others, they have a very uncomfortable sex life. Yes, you feel a lot of pain and a lot of irritation when you are having intercourse with your partner. And this one now, it has broken so many marriages. It has affected so many marriages because if you don't have an understanding partner, it becomes a problem in your marriage. Yes. So fibroids have become something that is disturbing women, especially now that we have changed even our lifestyle. We have family plannings that are affecting women's body. We have family plannings that are very high, having very high quantities of hormones, and they are affecting women. You find that so many women are suffering from fibroids. Yes. Then we have this FIBLO care. It also treats the tubal blockage, block fallopian tubes. And we tell a woman, if you have been having recurring infections like the UTI, you have PID, pelvic inflammatory disease. Pelvic inflammatory disease. If you have been having recurring UTI, you have been having PID, don't ignore, because these are the infections that are causing tubal blockage at the end of it all. Yes, and I can emphasize on PID because PID is an STI, it's a sexually transmitted infection. And most of the time, we have the PID, asymptomatic PID, and symptomatic PID. Asymptomatic PID, you can be having a PID and you don't have all those symptoms that we expect. Then we have symptomatic PID. Symptomatic PID is the one that you are having vaginal discharge, that it has an odor, kaarufu fane inakaa ni kama fish, a rotten fish. Then we have other women that have very painful sex life. They feel a lot of pain. Yes, you have abdominal pain, you have backache. Others, they experience nausea. It's like they are pregnant. Others, they suffer from the leg pains. You feel it's like you are having arthritis. Those women, they go all those. And when you are having PID, very few people think that it can be having a very serious effect, like causing hydrocephalus type of tubal blockage. Yes. So when you have PID, make sure that you get treated PID, both of you with your partner. Remember, a man, it may affect a man by maybe lowering the performance. PID lowers the performance of a man. It may lower the sperm count, but the biggest effect is on a woman. So for a couple, if you are suffering from PID, we wanted to be treated, both of you. You are required to be treated, both of you. Because even if we treat a woman, after some time, even if she gets treated, after some time, when they have intercourse with the partner, the PID comes back. The PID comes back again. So at the end of it all, you find that it has a very bad effect, especially now for the tubal blockage, causing hydrocephalus type of tubal blockage. So it's good if, as a partners, if you have discovered that you have PID, it's good you come to us, both of you, you get treated, both of you. That's the easiest part. In the next 6 weeks, you won't be having PID. It's that easy to treat it. But if you treat one person, if now you sleep with your partner, it comes back again, PID. Then you see now even your self-esteem as a woman, it goes down. It goes down as a woman when you have discharge that has an odor. And others, they come complaining that they are having an odor, but they are very clean. They usually clean their bodies every time now and then. But now we have to convince them and tell them it's not that you are dirty, it's only that your uterus na uterus iko ndani. Uterus ndio imegojeka. So even if you wash the outside part of your reproductive system, the discharge will still come out, because it's not the outer part that is sick, it's the uterus that is sick. So once now the discharge comes out, it becomes a discharge that you cannot even yourself, you cannot start that discharge. Yes. So we have tubal blockage. Let's go to tubal blockage. Tubal blockage, we use the FIBLO care to treat various types of tubal blockage. You can be having a tubal blockage because of those infections that I was talking about, like the UTI and PIDs. Those are infections. You can have tubal blockage because of adhesions. Adhesions huwa tunasema ni kama zinakaa ni kama uzi. Unaona hizi uzi za kushonea hiyo uzi ukiachilia hapa, uiachilie uiweke tu venye hujaiweka vizuri, inashikana hiyo. Sasa hiyo ndio an example of adhesions. They look that way. Then we have those people that have done pelvic surgeries earlier on. Maybe you are removing fibroids, you are removing ovarian cysts, maybe ulikuwa unaguzwa kidneys ama what have you. Sasa hizo surgeries, the previous surgeries, they may affect the tubes and they cause what we call scarring of the fallopian tubes. That's blocking. Then we have another type of tubal blockage. Another type of tubal blockage that is caused by ectopic pregnancy. Ectopic pregnancy pia uanga ina cause pia the scarring of the fallopian tube. Yes. Penye hiyo yai ectopic pregnancy ni kusema the implantation of the fertilized egg, it happened in the fallopian tube instead of the uterine walls. Yes. So sasa ile tube pengine ili rupture ama after kukatwa ile ikipona inapata what we call the scar. It can also cause tubal blockage. Then we have another category of women, those women who are suffering from endometriosis. Endometriosis huwa tunasema ni hiyo nyama sasa wakati wa periods inakatika and it may implant itself in any part of the body. It may be around the uterus, inside the uterus, or other organs outside the uterus. So if that kanyama now implants itself on the fallopian tube, then inafanya nini? Inafunga hiyo fallopian tube. So endometriosis pia can be a cause of tubal blockage. And Marian, most of the time huwa tunafurahia sana wakati mtu amekuja kama hiyo tube haijaguzwa. Unaona wakati wenye hiyo tube haijaguzwa, it's far much better to treat a tube that is undisturbed, like kutoka ile wakati yenye ulijua uko na tubal blockage haijaguzwa than ile yenye imeguzwa. Yes, we also help those people that have done those surgeries, trying to open that tube. But you see now the frequency of the successful stories sana inachangia kwa watu wenye haijaguzwa, tube haijaguzwa inafunguka kwa urahisi. So it's good if you have tubal blockage, instead of trying to do those surgeries, just come to Marian, we will help you. Yes. So we have another type of women, those who are having ovarian cysts. And ovarian cysts, you can have ovarian cysts. Number one cause of ovarian cysts is the hormonal imbalance. So as a woman, as a lady, make sure that your hormones are balanced. Yes, if they are not balanced, you get your periods irregularly, you have a high chance of getting what? Ovarian cysts. Yes, then we have another case, very people know about it, it's adenomyosis. Adenomyosis nayo ukiangaliwa the uterus, you ukaa ni kama iko na two pimples. It's like pimple like on your uterine walls. That's what we call adenomyosis, and it also causes infertility. So this FIBLO care medication, it has proven to treat most of the gynecological problems, and this is what we use. Yes, we have another category of women, those who are suffering from hormonal imbalance, and especially advanced hormonal imbalance. Yes, you are waiting for your periods, not that you are nearing even the menopausal stage ama premenopausal stage. Your period stays like 3 months before they come, then they come all of a sudden, boom, they come, the periods. Then after some time, maybe they can come even for like 5-10 days. Then after some time, they disappear again. That's what we call advanced hormonal imbalance, and it has affected so many women such that they are unable to conceive. Because now when your hormones are imbalanced, even tracing your ovulation becomes a problem. So Marian, we are here and we are saying Marian healing naturally to the world. Yes, everyone who is suffering from infertility, come to Marian. Come to Marian, and we will help you with FIBLO care medication. We also have another medication that we call fertility gem. But when you are suffering from the fibroids, blocked fallopian tubes, ovarian cysts, adenomyosis, endometriosis, and advanced hormonal imbalance, the best treatment for that is FIBLO care. And this treatment, you're supposed to take it for 3 to 9 weeks. 3 to 9 weeks. Those are 21 days to 2 months and 1 week. Yes, that's a very short time if you compare with looking for a baby for years. Just sacrifice for just 2 months. You just sacrifice, come to Marian Natural Remedies. We will help you with FIBLO here. At the same time, those women who are having fibroids, we usually advise you nutritionally. We advise you nutritionally because what you eat matters so much on the treatment of fibroids. You are a woman, you are having fibroids. You take a lot of sugars. You are taking a lot of sugars. You are taking deep fried foods. You are taking red meat. You are taking soft drinks. You are taking a lot of carbohydrates. You like eating chapatis. You like eating ugali, mchele, without making it a balanced diet. Yes, because eating carbohydrates is not a crime. But you're supposed to take carbohydrates and you take a lot of vegetables and fruits, and you take a lot of water. So if that's your lifestyle and you have fibroids, can you change from today? Even before looking for a treatment, you're supposed, once you know that you have fibroids, the first thing that you're supposed to change is your diet. The first thing that you're supposed to change is your diet. Just change your diet, what you eat. Yes, avoid taking sugary foods. Avoid taking deep fried foods. Yes, prioritize taking white meat. Stop taking those soft drinks. Hizo sodas, wachana nazo. Yes, if you have to take, let it be occasionally. If you have to take, let it be occasionally. Then stop taking a lot of carbohydrates. Instead, take small portions of carbohydrates with a lot of vegetables, fruits, and you take a lot of water. Take a lot of water. It will help you. Even when you start the FIBLO medication, taking a lot of water hastens the recovery period, the shrinking process of fibroids. So I wish you the best as you prepare to come to Marian. Yes, I believe even one day we will post your testimony that you are blessed. Don't give up because of suffering from infertility. We are here for you, Marian. Marian, we don't judge. We don't judge you now that you don't have children. No, just come to Marian. We will help you. Yes. So we have this. We have 2 branches. One branch is at Ngurubani Mwea, just behind the main stage. That's where we are, near Kenya Power offices. The other branch, we are located at Nairobi along Duruma Road, City Wall Hotel building, room number 5. Yes, so you can call us through 0714 698 414. 0714 698 414. Then we have social media handles. Our social media handles, we start with the TikTok. Marian Natural Remedies. That's our TikTok handle. Marian Natural Remedies. Then we have our Facebook page, Maria Savior of Fibroids and Infertility. Facebook page, Maria Savior of Fibroids and Infertility. Then we have Instagram at Marian Natural Remedies. At Marian Natural Remedies. Then we have YouTube channel. Kindly just subscribe, you like, you comment. YouTube channel, Marian Natural Remedies. Welcome.